So we're gonna talk about 3 exercises to help you squat pain-free. Now, a big part of what we're gonna be doing today is helping you do things where our feet are actually on the ground, because if we can't exercise with our feet on the ground, then we're never going to be strong enough to be able to squat. But there's some steps that we can take to make the squatting position a little bit easier so that we can get muscles stronger to be able to tolerate squatting. And that's what we're going to be talking about today. Hi, my name is Stephanie. I am with Empower Physical Therapy, and we help clients avoid surgery, injections, and medications while getting people's life back. We put the pieces of the puzzle together to really figure out where the source of the problem is coming from. Oftentimes, our clients have been to 3, 4, 5, 6 different healthcare providers without results until they've come into our office. And so that's really what we specialize in. So when we talk about the knee today, and we're going to go through some of these exercises, let's go into a little bit about the mechanics of the knee and kind of what happens a little bit. Weakness is a huge piece of when people have problems with squatting. Weakness, and then also poor squatting technique. So we're going to go into some exercises that can be the beginning stages of us being able to fully squat. Now, when we think about it, if this is our leg bone and this is our kneecap, so we've got to have a lot of strengthening in our hips. Hips are a big key for knee pain, because if the hips are weak, whether hip muscles are up here, it's going to allow that leg bone to kind of rotate. And so we've got to do exercises where we can keep that position, and we're going to show you some things today where it doesn't allow that knee pain to rotate. But also sometimes what happens is when we squat down, we tend to squat and our knees are over the toes. Now, there's times when these exercises are okay, but when we're hurting, they're not okay, because what happens is that knee pain, that knee bone will go up and you're basically putting it up against that kneecap. So you're driving that femur into the kneecap. So we want to actually shift our weight back, and when we shift our weight back, it's going to open up that space. So some of the exercises that we're actually going to show you are going to help us shift our weight back. Now, a lot of times what can happen is if your pain is still there with some of these exercises, we've got to go in and look at other sources, or we've got to take a step back so that we can do exercises that are even easier. Maybe you have to start out with some table exercises, or maybe some of the knee pain that you're getting is coming from other sources, such as the back or hip. Like, we always look at our mobility first to see how the joints move, because these are also big components of why you have pain in your knee. If things don't move very well, then you're going to be compensating going around it, and that's going to cause problems. So if you're noticing some of these things still aren't working, then definitely get in with someone that understands the knee to kind of figure out what's going on with your body so they can get back to doing some of these exercises. Because again, our first phase of therapy is mobility. How does the back move? How does the hip move? How does the knee move? How does the ankle move? If any of these are not moving, your body's going to be going around stuff, and it's going to put stress on the knee. So that's always our first phase. But we're not going to talk about that today. We're going to get into some of the strengthening things that we can do to help with getting you stronger while our feet are on the ground. So the first exercise that we are going to do is you're going to put a band around your knee. You don't have to. You can, but you don't have to do that. And what we're going to do is we're going to put our foot back onto the wall. And this is going to give us kind of like a partial weight bearing. Our knees bent, partial weight bearing, getting some input in through that joint. And so you'll push the heel into the wall. And when you do that, then you can kind of raise that knee up and then come back down and then relax. Push into the wall, raise the knee up, come down and relax. Now, if this is the bad side, you might not be able to do this on the other side. But the good news is that you're going to be working both sides, because you've got to stabilize on this side and in order to move this side. So if this knee is bothering you a little bit, then don't bend it as much. Keep it straight, a little bit straighter, push back, and then go out. And that might take some pressure off that knee to where you're not really bending it. You have it kind of more in a little bit of a straight position. But you can do this exercise, I would say, like 10 times. If you can do it on both sides, fantastic. If you can't, just do it on the one side where you're working the bad side is pushing up against the wall. But you can do these 10 times and do a couple of sets. I always say start out once a day, and then you can move to twice a day on something like this. Now, the next exercise that we're going to do is You can use weights if you want to use weights to kind of give us a little bit of extra load, but you don't even have to use weights. Your feet are going to be shoulder width apart, and what you're going to do is you're going to really shift your hips back. So the knees aren't going to really be bending that much. You're going to kind of keep them, they're not going to be locked out, but they're going to be just slightly bent. But that's it. You're not moving the knee. You're basically moving the hips, and then what you're going to do is you're going to push through the heels of your feet, squeeze the glutes, and come back up. So we're using all the muscles, hamstrings and glutes that we want to use that often are very weak while our feet are on the ground. So you just, again, keep the back, don't round the back, keep the back straight, shift, you're basically bending at the hips, push through the heels, and as you push through the heels, squeeze the glute and come up. These will start working on the hip muscles in the back, and again, you can use weights in your hands to kind of do the same thing as you keep the back straight. Again, squeeze the glutes, push through the heels, and come all the way up. So that's another exercise that we can do to help with knee pain and help us with squatting. Now, again, if you have any pain with this exercise, any pain with the last exercise, you're going to want to make sure that you are doing it correctly. And if you're not and you're still having pain, you're probably not ready for this exercise. We'll have to move you to doing some table exercises initially. The third exercise that we're going to do is we're going to use a sink. And this is a really, really good one because we can really shift our weight back so that we can get the glutes and the hamstrings to fire. And so what you're going to do is your feet are going to be shoulder width apart. The knees, again, are going to be not like locked out, but just a slight bend to them. But we're not bending the knees down when we do it. We're really shifting our weight back, holding on to the sink. And what you're going to do is you're going to, again, push through the heels, squeeze the glute, and it's like your head has a string that's going to pull you straight up. So what we don't want to do is come forward and up because you're just using the momentum of your hands. You're literally sitting back, and then you're pushing through the heels, squeeze the glute like you have a string, and you're pushing to come up. Again, squeezing the glutes and the hamstrings. You're really going to feel these in the back of the legs. You're going to feel it in the knee. We're going to be able to open up the space because we're really shifting back, so it takes a lot of pressure off the knees, but it's using all the same muscles that we would use in order to squat down. So give this a try, doing it about 10 times, and you'll do maybe a couple of sets of these, and you can do them 1 to 2 times a day. And again, you shouldn't have pain in the knee. Doing this. If you have pain in the knee, we need to progress you to a different exercise, put you back on the table, work on getting things a little bit stronger, and then bringing you back down to doing these types of exercises. If you like what you've heard, make sure you subscribe to our channel. We're putting content out all the time, and that way you'll be up to date on all the exercises and things and the tips and tricks that we give our clients. You'll be able to learn them as well.